Me did the young antechua, and maybe I'm discovered for Europe. I come a bush and for Ghana. No, me used to Taptap Send. Taptap Send. No fee mobile money transfer. Eye easy, eye convenient, eye fast, and some say free. Won't you she? Me discover a map him. Tap Send. Intienne. Also download the Taptap Send app. No, ever mobile phone so free. Na first ka come we bush and for Ghana for na. Taptap Send. Papa no.
Property Investor Africa connects investors, buyers, sellers, and partners across Africa to creating trusted opportunities in property investment.
Welcome to Property Investor Africa, your gateway to Africa's real estate revolution. Whether you're a developer or seller of prime real estate in Africa, whether an investor or buyer hunting for opportunities, or you're a supplier of real estate products or provider of services in the real estate industry in Africa, this is your marketplace.
Hello, and good evening, everyone, and welcome to the OT Health Talk Show. My name is Abina, and today I'm with Miss Barbara as my co-host, who I'm going to hand over the mic to soon so that she can properly introduce herself to us. But before that, just a few housekeeping, as you all know. This show is brought to you by Taptap Send, and the structure of the show is we'll have Dr. Blessing, who's going to speak to us about knee and hip replacement, and then after that there'll be a Q&A session, which my co-host will lead on. Baba, please give us a quick, short introduction of yourself for our viewers who are seeing you for the first time.
Okay. Good evening, everyone. Thank you so much for having me on here this evening. My name is Baba Pobi. I'm going to be your co-host. Kindly drop all your messages in the drop box down there, or you can raise your hands and we will call you when it's time to take in any questions. Thank you.
Thank you, Baba. Yes. So, as Baba has said, you drop your questions or raise your hands when the time is right, and Baba will be so kind to lead on the session. So now, without further ado, we're going to hand over to Dr. Blessing, who is not a stranger on our show, who's going to talk to us about these joint pains, because, a lot of us live with these joint pains, and for many of us, it makes day-to-day activities very difficult. So thank you, Dr. Blessing, for the time. And yes, without further ado, please take us away. You're on mute, by the way, Doctor.
Okay now. Is it okay now?
Fantastic. We can hear you.
Very much for giving me the opportunity once again. As today, I guess I don't have to introduce myself because most people know me already. So the time is far gone. It's 40 minutes past 9 here in my local time. So let's begin. So now today our topic is hip replacement, hip and knee replacement. I thought the last time we spoke about all these courses and all this but today mostly we're talking about the treatment of the hip and the knee replacement. Now, why do we do hip replacement? I think the last time we spoke about arthritis, its effect and its impact on the body. So I think today mostly the discussion will focus on the treatment. So once again, the question is, why do we do hip replacement? Now, there are so many. There are 2 or 3 reasons why we go and do hip replacement. One is by fracture. If there is a fracture of the femur head, we do hip replacement. Or either there is an arthritis to some stage or to some degree or to some extent, we do hip replacement. And also there is a cause, or there's another reason why we do hip replacement or hip replacement. Mostly it is by, let's say, acquired by a natural cause, of which whereby there is a blood supply being impeded, like to the femoral head of the hip. So let's take it one by one, and then let's go with reason for why we do hip replacement is by there is one, if there is a fracture. Now, if there's a fracture to the femoral head, we do hip replacement. Now we have some like classification or some stages in the fracture where you do. Now we have the Garden 1 classification, we have the Garden 2 classification, we have the Garden 3, and then the Garden 4 classification. Now we know that in the human body there is blood supply moving throughout the body, go to the hip, the knee, your hands, your lower limb, wherever any part of the body there is blood going now. Now, if you have a fracture to your femoral head, now, with the Garden 1 and then the Garden 2, we don't do hip replacement, we do screw, or we put like metal, like to hold the fracture. Now, if we have a Garden 1 or a Garden 2 like classification of the femoral head, now, the blood supply to the femoral head is being or is intact, and that means they are not like disrupted, so there is blood still going. Now, if you have a Garden 3 and then a Garden 4 classification of a fracture of the femoral head, now there are these two main artery which supply blood to the femoral head, which is the lateral circumflex artery, and then the median circumflex artery. Now, with the Garden 3 and then the Garden 4 classification, now this artery is being impeded, or this artery is being blocked. Now, if this artery is being torn or blocked or being impeded, there is no blood supply moving to the femoral head. In that case, there's a condition called a vascular necrosis. So blood doesn't move to the femoral head, and that means the head or the femoral head get dead, being spoiled. Now let's take example of this common disease. We this disease called let's say diabetes. Like we've heard in our local homes in Ghana, wherever we are from, like if people have diabetic, sometimes we go and do amputation. We do cut their leg or their feet or their whatsoever it is. Now, why do we do that? When diabetic get to some point, there's no blood supply to the feet, and that means we see their wound being get delayed to heal. In that case, the only option we have to do is we have to cut the foot. Now, this a classical example when it happens to the head of the femur. When there is a fracture to some degree where there is no blood moving to the head or the femoral head, we cut them and then we put a hip replacement. Now, with this type of hip replacement, we only use replace the femoral head, but later on we go about that. Now, another reason why we do hip replacement is by arthritis. Now, I know in this page you've spoken so much about arthritis, about knee pain, hip pain, and whatsoever it is. Now, with arthritis, to some degree or to some extent, when it happens to the hip, at the fourth stage, it causes so much damage to the acetabulum and then to the femoral head. Now, a classical example or some factors or some symptoms of arthritis fourth stage is because now there is a bone bone joint space narrowing. Now, in this case, the cartilages are being destroyed completely, so there's always pain. And then happens to be that when the joint space are being like narrowed, in this case, you see the patient always like of complaining of pain and stuff. Now, a classical example of arthritis stage 4 of the hip is that there is a morning stiffness to the knee, morning stiffness to the hip, or to where the arthritis is being occurred. Now, why is it like arthritis, or why is it like a morning pain in arthritis patient? Now, while you go back to your sleep, 4 hours, 5 hours, 8 hours, or whatever hours you sleep, in that period, there is no movement in the joint. In that case, like the joint becomes so stiff and stuff. So once you wake up, once you make 1 or 2 steps, there is pain. Yeah, and this is because like the cartilages, which will help you have some movement with the joint, are being destroyed. So the bone will rub against each other, whereby and the joint rub against each other, and then there is a classical pain. Most people with arthritis stage 4 to some extent, their pain gets relieved if they do 1 or 2, 4 or 5 steps or do some exercises. Their pain relieves is because now they're trying to move the joint, and then the pain goes back. Now, another reason why we do hip replacement is that this is a disease called the leg calf disease. Mostly it occurs in bone formation or bone growth as a kid once you grow. But this kind of disease is rarely, but it does happen. One out of like 500 people in Europe have this condition. Like there's a natural or like occurrence. Some believe it's like genetic. Some believe it's by natural occurrence. This is similar to the fracture, but in this case, this is not due to fracture. This is due to a condition where blood is not adequately being supplied to the to the femoral head. Now, hip replacement. There are 2 types of hip replacement. Now, we have the total hip replacement, and then we have the hemiarthroplasty. Now, with the total hip replacement, it happens mostly in arthritis. Now, with the total hip replacement, which happens in arthritis, is because we replace both the acetabulum and then the femur head, because in these stages both joints are being affected. So we fix the acetabulum, and then we fix the femur head. Now, with hemiarthroplasty, which is a partial hip replacement, or you can call it a mono hip replacement. Why do you call it a partial, or why do you call it mono? We call it mono 1 because we call it mono hip replacement or a partial hip replacement because only one of the joint or only one of the bone is being replaced. It's either the acetabulum being replaced or the femur head is being replaced. But mostly 99% or 95%, it is mostly the femur head which is being replaced, like due to accident, due to fracture of the femur head. So we have to only replace the at the femur head. Now, with the third condition, which is the leg calf disease, which is a natural occurrence, in these cases, we mostly replace only the femur head. Now, total hip replacement or hemiarthroplasty, it is mainly done in young patients, and then the total hip replacement it is mostly done for adult and stuff. Adult from 75 years upwards, because of the density of the bone and the strength, most sometimes we put cement in the metal just because that their bones are being weak, so we put metal to support the holding of the treatment. Now, what is the prognosis, or what is the what is the recovery period for hip replacement or the knee replacement? Like, I always say that every human being is different. What I can bear, like you cannot bear the same thing. So for me, I feel like there is no adequate prognosis for people in their recovery exam. There will be the same surgery done to person A, done to person B. The person the person can recover no pain or have no any complication. The same surgery, the same procedure, the same instrument, the same thing used, but other person may have this may have a condition, or may have pain, or may have a complication. So about the recovery time, or about the prognosis, one, with a hip replacement, mostly in adult patient, or let's say in the elderly patient, their recovery time takes time, or it gets delayed. Right after surgery, within 24 hours, we start like physios. But to have an active movement, it takes time, more than a month before they can have an active movement. Even with the active movement, they have to use assistant, like using a walker and stuff in the hospital just to assist them in working. In the young adult, most of the time they get recovery easily within 24 hours. As the same thing, they start physio, movement and stuff. But after a week or two, they can walk only with one stick in their hand. After a month, they can walk completely without any assistance, or without any help, or without any instrumental help. With the young, or with the elderly patient, most of the time they have to use assistant sticks, or they need help for a long period of time. Most people also will be on the bed for a month before they can walk, or before they can have movement. That is why I said every patient is different. It depends how the body responds. It depends how your body responds. Now, if a patient is not able to walk after a week, or being laid on the bed for more than a week, or 2 weeks, or a month, most of the time we have to send them to a special place where we show them how to walk, how to use the stick, how to move. Because in that case, their gait, I don't know how to explain the neurology term for gait, because their walking become distorted after a month. We are not walking, so we send them to a special place to help them, or to teach them how to walk again like a kid. Sorry, like most of us, while we are growing up, our parents used to help us. Okay, do this, make a step like this. The same people with hip replacement or knee replacement. After a long stay on the bed, we have to send them to a special place to help them to walk. Now, people. Now, if you're an adult, or if you're a young patient, and then we go for hip replacement. Now, with the protocol, nationwide, and as I said once again, medicine is different from every country and stuff. Here, with where I practice now, hip replacement, most of the times within 10 to 15 years, if we have to go, so that they will check it and then replace it, or either they'll do another surgery, either to change the metal, or clean the metal and fix it again. So if you have a hip replacement, 10 to 15 years, you have to go for checkup, and then either they replace the metal, clean, wash it, and then put it back again. Now they have been a new guideline that they say within now from 7 years now to 10 years, you have to go for checkup, so they can clean or change your hip replacement. So within 7 to 10 years now, there is the new standard and a new guideline that has been brought recently. Now from 7 to 10 years, you have to change your hip replacement surgery, or your knee replacement surgery. I didn't focus so much on the knee because the timing, and because of the hours or the minutes I do have. I know most people have questions, and I love the questions and the answer part. So I'll end here, but just know that the knee and the hip, most of the time, they go the same. The replacement surgery, they are all the same, but the focus is mostly today is on the hip. Remember, the last time that you spoke about arthritis, the last time I told you guys that I believe in the medicine and I believe in everything, but we have a conservative treatment, and then we have a definitive like treatment. In the early days of your arthritis, it's okay, like to use the physio, like to use the medicines or the cream or the gels to suppress the pain. But when the arthritis like get to some stage in your life, trust me, no amount of physio, no amount of gel to inject in your knee will help you. All these things are not a definite treatment. They are a conservative treatment. That will help you. The best thing or the best treatment for arthritis, it is surgery. Get the replacement done. Trust me, people most of the times are afraid of surgery. They are afraid like the cuts and all of you. My mom is suffering from a condition that he has to go for surgery. You know, our local people, he said, he's not going to do the surgery. He has an eye problem. He's not going to do the surgery. He believes in it. This like local medicine and stuff. He put in the drug on. But the condition that that she's suffering from has nothing to do with putting eye drop and stuff. But no, he said, I've been convincing her, Mama, go and do it. It was like, you understand? I told her that it is safe and what have you, but he said, he said, like people said. But I was like, it is safe, but he was like, she's not going to do it. In the same way, if you have a condition that, and if your doctor tells you, oh, please, let's do surgery, trust me, there's a complication in everything. Even like if you take the drugs, or if you take the drug, it have a condition on your liver, it have a condition on your kidney, it have a condition on your body. The same way surgeries have a complication. But trust me, it is 95% safer, which is a definitive like treatment. Thank you very much.
Short and sweet. Thank you, Dr. Blessing, for taking us through the goods, the pros and cons, goods and bads, recovery of knee replacement. Oh well, there are already questions flying in the chats, but please hold off. We'll come back after a quick commercial break, and then we'll answer all your questions.
Physical money and but me do rap to say me send you in a minute in Sabakandia and then one Taptap Send.
Yeah, ebusiafo we didn't did an akuma patchlewa one. They recommended Taptap Send amamo. And that's how for also kofa baby na ya basa our rating so ye omo ye A1 nti obian load do Taptap Send that also is ka for Taptap.
Yɛbɔ de wɔkyerɛ amansan yɛbɔ de wɔkyerɛ Ghana fɔsɛ yɛwɔ akwantu ne yɛde sika kɔfie nie me yɛn fɛnfa baabi a yɛbɛnu yɛn ho Taptap ɛdɛmu tuwa Taptap Send in this street
the Taptap de no an ɛkɔ
Taptap de ɛnua na yɛ nyinaa ɛyi
piao.
If you're looking to buy real estate right here in Ghana, you're looking to buy a property in Ghana, and you are a diaspora, and of course, one of the most important factors you also think about is your security. Then if security is your paramount, one of your paramount factors in considering whether to buy a property or not, and of course, you have to consider some of the prime neighborhoods right here in Ghana, because of course, those prime neighborhood comes with a very high level of security in terms of, your properties and life. And those areas, of course, includes East Legon, it includes Airport, it includes Chado, it includes Adrengano, it includes Ridge, it includes Jowulu, and so many other beautiful neighborhoods. Now, those neighborhoods, trust me, they are prime and they are safe and conducive for people or environment or family looking to actually relocate back here in Ghana. So in today's video, I'm going to show you a property inside West Trosako, which is also considered as a very safe neighborhood for you to actually look at considering buying a property.
Whitewall Properties has all your property needs at amazing prices. Our unique development includes our flagship project, Arlington Court, which has a panoramic view covering several acres of a grass skyline. Some of our standard features include our gorgeous swimming pool, fitness centre and a communal garden.
Hello everyone and welcome back. So this is now the Q&A session where we take all your questions pertaining to either the topic at hand, which is knee and hip replacement, or any health topic, any health question that you have. And Miss Baba will be taking us through this session. So I will now hand over to Miss Baba.
Okay, thank you so much, Abna. So I will just go straight into the questions. Dr. Blessing, let's go to the swimming one. There's a question which says, when can one return to gym or swimming?
Hello, you hear me?
Can you hear me?
Yes, please. Yeah. Okay. So now, thank you very much. I've seen the questions in the chat box, and I love it. I love this part of the section where people ask the question, or people ask. I love this question, so I love the Q&A questions so much. So now, when can people return to swimming? Now, after hip or knee replacement, mostly we advise after 4 to 6 weeks, plus or minus. You let's do 8 weeks, so 2 months. You can return to any activity you want, but there is a condition. Now, with swimming, you can go ahead. I've seen like another question in the chat. I don't want to rush with the response, so I'll just take my time and answer this question before I add it. But after hip replacement, you can go ahead and do any activities like sports. I forget this person. There's an athlete or there's a sportsman who has a hip replacement. A very famous, like either a tennis player or a volleyball. I think it's a tennis player who have a hip replacement, and he's doing all this running, all this like tennis and everything. He has a hip replacement. I will check, or if like anybody can help me search an athlete who has a hip replacement. He has a hip replacement, but he's doing all this activity. So after hip replacement, you can do any activity that you want, but there is like there is a condition, or there is some points you cannot go too much. But for swimming, device you can go, but mostly wait for 6 to 8 weeks, approximately like 2 months, because during that period, like the wound, everything, the quadriceps and all the cutting, everything has healed completely. In that case, the quadriceps muscles have been able to grip the metal like being placed in your hip, so they are strong enough to do any movement, and then like your pain literally has healed. So with swimming, go ahead and do it.
Okay, thank you so much, Dr. Blessing. So with the athletes you're talking about, I think I found a few. One is Andy Murray.
Mm-hmm.
Very good. Andy Murray, very famous tennis player. I don't know if anybody knows. Very famous player. Yeah.
And there is Bo Jackson, who is a dual sports icon. There's Rod Laver, Tennis Hall of Fame, Arnold Schwarzenegger.
You see,
I think you know him.
All the people do big activities than we that we're not even having done hip replacement, and see how active they are. They are doing all these things, running. I know that is Andy Murray. See how you run, bend, smash the ball, and everything. If you don't know, you could see that he's a fresh or somebody who has not even had a surgery, but he has a hip replacement in his hip. Yeah. Thank you very much for the research.
Thank you. So the next question is, when can one have sex after hip or knee replacement?
Okay, I love this.
Of course you would, Dr. Of course you would.
I love this. I love the question because of the thing being mentioned, but because now after surgery or during your hip replacement, there are things you should do and the things you should never do. Now, one of the things that you should never do, it is like bending more than 90 degrees. So you can have sex, but the position is very important. One, you can be as a woman, you should be lying down. As a man, you should not be bending too much. So mostly, if you're going for toilet after hip replacement, we give them once you're with a local toilet at home, we give them a special instrument to put on the toilet so they will not bend more than 90 degrees. In the hospital, we have it, but while they are going home, also we recommend that instrument for them to be there with them so that you do not bend. Because if you do that, your hip can remove, and then there will be another issue. So do not bend more than 90 degrees. 2, you should not cross your leg. If you sit down, you should not be putting your one leg on each other. If you do that, the hip can dislocate. So you can have sex, but please do not be on. Either you can stand, or either you can lie on your bed. So this position, once you have this replacement, once you have hip replacement, you are bound forever. Not forever, but to a certain extent, you cannot do it. And that is, let me say, like at the doggy position. You cannot do it once you have a hip replacement. Not bound forever, but to some certain extent. Or you should be very, very like cautious if you're having sex with some positions. Most especially doing a doggy position. Both the male and the female. So that is it. So you can have it, but please, some positions you should never like do it.
Can I ask a question? Sorry.
I know you asked a question. Definitely, I know. Go continue. Ask a question.
As a doctor, have you ever experienced or have you ever had a patient be having these activities and then have their hip dislocated in the process?
Trust me. Personally, like I am afraid of like patient. Patient do lie a lot.
Oh, so we are here to learn, isn't it? Thank you.
Like patient do lie a lot, and the patient will never tell you, "Oh, doctor, my hip gets removed because I was having sex." They will never tell you unless it happened. Unless the hip replacement happened at the hospital, maybe on the bed while they are moving. But once they are home or they are doing some risky activities, and then the thing got removed, they want, "Oh, doctor, I was sitting down or I was having sex, and then my hip removed." They will never tell you that. But yes, I have patients after surgery. Their hip get removed, they come back. Either we do an external fixation, or maybe we have to like cut again and then like put it back. So it happened. But them telling you, "Oh, doctor, I was having sex before because the thing removed," never have I heard that. Okay. But I know it is possible. They've done, but no one will come and tell you, "Oh, I was doing this and I think it removed." Nah, they will never do that to you, or they never tell you that. So yeah.
Thank you, doctor. Thank you, Baba.
Thank you. Before I go back into the comment section, I would take a question from Mustafa. Mustafa, can you unmute yourself? Thank you.
Thank you very much. And
Dr. Mustafa Akwaba.
That's it. Listen, thank you very much, and Baba, thank you for joining this session. Listen, I can see how you are very excited and you are explaining everything into details, even things that to the extent that you are giving examples and all of that. That is quite exciting, and I'm enjoying the session. My question for you is, how much do you make after these hip replacements? So I get a lot of people contacting me to say that, oh, they want to come and do a hip replacement abroad. For example, Hungary is one of the countries we know in Europe. The healthcare is a bit cheaper. So if in case a family wants to come to Europe, how much would it be? And please, you can answer the question by not mentioning additional positions or whatsoever. I thank you.
So Mustafa, like if I understand you, like you want the cost of a hip replacement done in Hungary or in Europe?
Yes, in Hungary specifically, yes.
Okay, yeah. I can give you a rough figure. The last time I asked I have this question from a friend of mine in Nigeria friend. He told me he would like his mom to come and do a surgery. I asked him, and then my boss told me it is between like 3.5 million to 4 million the local currency. By conversion, it was like 10,000 to 12,000 like euros thereabouts. As you said, Mustafa, yes, the Hungary healthcare is very cheap, but with other like European countries like the Swiss where you are, the German, the UK, it is much higher. But I think like this like 10,000 to 15,000 euros. It is mostly for the surgeon, the anesthesia, and then like the bedding and everything. But I think after that, your course, your feeding, everything will be taken by yourself. So by the surgery itself, my boss told me, like 10,000 to 15,000 for it. That was as at last 2 years ago. But for now, I don't know. But he gave me a rough figure. It was like 10,000 to 15,000. But for now, for currently, I don't know. You know, people always increase stuff as the year goes by. So yeah, Mustafa.
Okay, just to say, at our places between 25 to 40,000.
You see, so just pray for me. Once I finish my training and become a special, and I'll help you for free.
I was going to say it's almost the same as the UK. Really, it's about the same 10 to 16,000. However, if you want cheaper places, just by a bit of research, they mentioned Poland, where all inclusive packages could cost about 8,000.
You know, this like Eastern Europe is quite cheaper. You know, as compared to the western side of the Europe. So I agree with the figure given.
Yeah.
Not to go too far off from what is just being discussed, there's a question from EQ. It says, does the NHS cover all hip replacement costs in the UK?
I'm not in the UK, and
difficult for you.
In the UK, if there is a coach here with us, she's the best one to answer this question. I do not know about the UK.
I think we'll have to get back to you. On that when Dr. Akos comes on.
Yeah, okay. Thank you very much.
Yeah. So, Dr. Blessing, your next question is, will my new joint feel different from my natural joint after replacement?
Okay, so now, I don't know what you mean, the joint, but if I understand the question for sure, either when the surgery happened at the left side, of course, you will see like a different image, or like you see like a metal like being placed in your joint, but how the function and the movement will be the same. But sometimes there is +1 or +2 or -1, -2 of your length of your feet. Either one will be longer than the other. So most of the time, if that happens, or if it is +1 or +2 or -1, -2, it is like it is being considered okay or no problem. But if it is above +3 or -3, that is why we recommend a shoe. Either we give like there's like a special shoe we give to them. Either we lower the shoe or we pile a shoe so that it become level, so that their balancing or so that their coordination won't be like distorted. So if it is normal to have like this complication or this issue after hip replacement. Either the operated leg becomes shorter or longer. So when being short, we get on a shoe just to make level with the other one. It become longer, we give them a shoe in the unoperated one, so their length become okay, so that your walking or your gait become like stable. So like with a joint or your joint, the function won't be different. If I understand the question, the function won't be different, but the imaging or the length, sometimes it becomes your leg become longer or shorter than the other one, which is totally like okay when happening after the surgery.
Thank you. So there's an answer to the question that was asked about NHS covering hip replacement surgeries. So is it A?
Yeah. So I was going to say, just to chip in, I had done the research, so yeah, it's correct. And the eligibility criteria is basically to be a resident, and your surgery must be deemed clinically necessary. So, aka severe pain, reduced mobility. So those are the eligibility requirements, and it does cover everything from consultation, surgery, anesthesia, hospital stay, and even your necessary physiotherapy, all included.
That's Dr. Blessing. So I've got two questions for you personally. So I know someone who was involved in an accident, and just like your mom's situation, she believed that they should do the whole Efi idea, which they went to, one of those traditionalists to get it, is it tied, or I don't know how it's done. But here's a situation, one leg is shorter than the other. So in this case, will they have to go through any surgery to try and get the length of the leg the same as the other one, or do they have to get that shoe you're talking about?
Okay, like is it a hip or is it like a normal joint being broken and become shorter?
A normal joint being broken.
This is like the normal bone being broken or the hip?
Yes, a normal bone being broken. Yes.
Okay, and then the leg has become shorter.
Yes.
Okay, so now the reason why the bone or the leg has become shorter is because at the formation, it's either like the bone like didn't heal like properly, or maybe the anatomical nature of the bone like not be correct. Now, if you have a fracture, sometimes it gets like slipped.
Yeah.
So most of the time we do example, the people with like a wrist fracture. Most of the time, when it's broken and there's like a dislocation, sometimes we do like external rotation just to fix the anatomy. If that thing didn't happen, most of the time, I have a seamstress who wants to. He has her customer coming to the display, and then anytime he measures the length of the long sleeves, one is longer or one is shorter than the other. And then the patient has to confirm that he had a wrist surgery, a wrist fracture, and then he didn't know after a week when we went back to the hospital, the bone formation has already happened. They tried fixing it, but it wasn't. So anytime he buy a cloth, he has to send it back to a long sleeves cloth. He has to send it back to the seamstress to like make one of the things shorter before it can fit. So now it is shorter because they didn't fix it like properly, and because it had been a slip of the bone, it had formed already. Like correcting it be very, very difficult. So it is because of a wrongly bone formation. That is why it has become shorter. Like I really don't know the extent or how many years is the fracture. But in some cases, once the person go back, they can fix it. But when it gets to the worst stage, there's nothing that the doctors can do. That the person has to live with this condition or this condition throughout his or her entire life.
Okay. Thank you very much. And the next question has to do with the bit that you were talking about kids. The legs not forming properly also, I think that's what you mentioned.
Okay.
So at that stage, do they need to get surgery then, or do they have to wait till they're a bit older to get that surgery done?
Most of the times when it happens, once you see that issue in the young age, let's say like within your teens, we don't like try to like give too much pressure on the kid. But after 18, nowadays the adolescent age and the aging system is different. I've had a female girl, 9 years, having menstruation. I was like, but I remember back then in high school, I learned like 14 years, 15 years, even 18 years before they had menstruation. I've had a 9 years because I remember he had a fracture in his knee, and then we have to put casts or put like POP and put that to a POP. So per the protocol, 9 years, like you don't need to put or you don't have to give them like antibiotic prophylaxis. But he had 9 years. So I asked my boss, dog, please, I need like prescription for this because there's some drugs I cannot prescribe unless you're boss. So I asked my boss, please, I need like a DVT drug because this patient. No, I didn't give that patient the DVT prophylaxis. So my boss asked me, how old is the kid? I said 9 years. I said male. I said like a female. He was like, okay, but if it is a male, like no need of DVT prophylaxis. But if it's a female, ask whether he has had menstruation. If I had a menstruation, I was like, nah, boss, he's just 9 years. I was like, ask, maybe, who knows? Luckily for me, I asked. The mother said yes. I was like, Jesus Christ, 9 years having menstruation. This is my first time seeing. I've seen 14 years, which is okay, but for 9 years, this was my first time seeing that. So you see. So now with this condition, the leg calf disease or the Pectin's disease, with from 2 years or to 10 years to 18 years, we don't bother them. But when they grow, let's say to their 20s and they are 25 years old, yes, we can start. But if the pain is not too much like in their teens, most of the time we begin the surgery from 20 years going. But if the pain is too unbearable for them in their teens, most of the times we go and do the surgery early. But we know that from, let's say, 14 years to 18 years, like what we study in the books, the bone are still growing. You understand? We know that from first year to 18 years, that's when the bone grows. But I can assure you, I know people in their 20s or 30s that they are still growing taller. So it's like I said, like sometimes what we learn in the book is different what we learn in the or how to meet at the practice. For me, I can see that for me, after 18 years, like I was still growing. In my 25 years, I could see that I'm still growing taller. Even now, even like I bought clothes last year, this year, if I put them on, it comes to come on me. You understand? I feel like I'm still growing. So we learned that, okay, from 1 year to 18 years, bones stop growing. But personally, for me, I can see like, yeah, I'm still growing taller, I'm still growing wider and stuff. So in that condition, if the pain is too much unbearable for them, we do early surgery. But if not, we wait after 20 years or 25 years, then we do the surgery for them.
Thank you, Dr. Blessing.
Mustafa.
Dr. Mustafa says, hey, Tola, we here. Yeah, that's something I was going to comment on. You're very lucky. You're still going, Tola. So our time is almost up. There's one more question that I'm going to ask. That's, what advice would you give to someone who is going through pains in their joints? What advice would you give?
Okay, so this topic or this has been discussing on this page several times now. There can be so many reasons. There can be so many issues like going on, like with your joints or having joint pain. Some of them like your like autoimmune diseases, like the arthritis, other conditions can affect your joint and what have you. Your sporting activities, your gymming. It's good to have exercise, but there's always a complication or there's an issue in it. So there are so many things to do now. Like get it checked. In like our local country or Ghana, wherever you're coming from. Anytime we have a pain, we assume we need like painkiller, which is okay. the last time I'm very careful speaking about pain in this page, because the last time I spoke about pain, people roasted me on this page. So I don't talk about pain or painkillers on this page. But it's good to have a painkiller. But for me, I do not really encourage that to do. Sometimes your body responds to sometimes your body still responds or fights or help you recover all this pain. So if your pain has been like consistent, like a day or two, a week of pain can be, let's say, how you slept, how you move, or how you put on your steps. But if the pain is too unbearable after a month, please go get it checked down. Don't go and have like a counter medication of painkiller and taking it in the view. Like, get your pain being done or being faced or being checked by your doctor. He can do the X-ray for you. You could find maybe there's a reason why there is this joint pain like going on, or why there is this pain wrong with you. Like, do not assume, that, okay, you are, okay, I'm a nurse, okay, my mother is this, so I know what is like, get it done, get the examination done. Maybe sometimes, like, your blood examination can tell you what is wrong with you, why you're having this pain here, why you have that pain there. Just go there, then have it checked and have it done.
Okay, thank you, Dr. Blessing. Before I hand over to Abena, what I would say is thank you so much for helping us better understand hip and knee replacement. If you or someone you love is struggling with ongoing joint pain, speak to a healthcare professional and explore the options available. Thank you. Abena, over to you.
Sorry, so I was going through the question. I found this question I don't know, like you said, like, is it safe to travel by public transport after hip or knee replacement? I don't know if that question wasn't asked per my knowledge.
No.
Yeah. Okay. So now it is safe, like as I said, safe to do everything. But once again, with the public transport, if the chair is too low, below 90 degrees, I advise no, just stand. But and I know that most buses, their chair are not below 90 degrees. So yes, it is very safe to use the public transport after knee or hip replacement. But just that, be very like cautious after hip replacement. Not only hip replacement, in every surgery, not every surgery. Let me focus on my field. After any fracture or whatever we do, please be very cautious. Wait till the time your doctor has given you to do certain activities before you can go back. Thank you.
Fantastic. Thank you, Baba, and thank you, Dr. Blessing. And yes, this is not the last you see of Baba. She'll definitely be back hosting. And I believe, Baba, you are also a healthcare professional, or at least...
Yes. Yes.
There we go. Very soon she might.
Tell us more.
Very soon she may even be the one I'll be hosting as a healthcare professional. So this is not the last you've seen of Baba. Don't worry.
Introduce herself, her profession is very important.
I'll tell you the next time we come on.
Yes, Dr.
I need to give
next
you
time.
suspense. Yes.
Thank you. Perfect, Baba. So be in attendance next week, okay?
Yes.
Okay.
Yes.
But thank you so much, everybody. Thank you for giving your time out to come here week in, week out. Without you, this show will not be successful. Just a few reminders before we let you go. So tomorrow is same time, same link. We have a time with Taptap Send. And then on Friday, every Friday, we've got Ask the Lawyer as well. So as you know, what's it called? Immigration laws are always moving around. So please do join and ask your questions. And yes, I think that will be it for today. So I just want to thank everybody once again. Thank you, Dr. Blessing. Thank you, Baba. Like I said, you haven't seen the last of Baba. She'll be hosting a few more shows with us. And like, she is also a healthcare professional. So she may be on here one day to give us
Why can't you say the head professional today?
Because she wants to say it next week. Next week, join the show. She will properly introduce herself and what she does.
Thank you.
Thank you, everyone, and have a good evening. And see you all next week. Bye.
Thank you.
Bye. Mustafa.
How are my doctors doing, Dr. Abna and Dr. Kwejo?
That's good.
Oh, by
Dr.
God's
Blessing.
grace. By
Ma,
God's
Lizzie.
grace, we are doing.
We will talk, but
Dr. Blessing.
I will.
I know why we talk. I know.
You know, but you haven't called me, so you know. Anyway, I said back door. Dr. Abna is Dr. Abna's ears are itchy. We are not itchy.
Hey,
Yeah.
let me go. I just saw Dr. Kus was on the show and she didn't.
Oh, was she? I didn't see her.
But she just said bye because we even needed her expertise.
Hello, guys.
We needed you to come and tell us about.
Hello, Dr. Kus.
Fine, thank you. Oh, yeah, hi. I said fine, thank you.
I saw a very beautiful picture of you. I said, my daughter is looking pretty.
So, Christica Manian. Pretty me do rap to say. From me, send Yama with in a minute in Sabacandia. And then one Taptap Send.
Yeah, ebusiafo. Bidin di na nakuma pachrewa 1. They recommended Taptap Send amamo. And that's how for aba. O send ko fa baby a. Na ye basa. Omo rating so ye. Omo ye A1. Nti obia no do Taptap Send. Na on say sika for Taptap.
Yɛbɔ de wo kyerɛ amansan yɛbɔ de wo kyerɛ Ghana for say yɛwɔ akwantu ne yɛde sika kɔfie nie me yɛn fɛnfa baabi a yɛbɛnu yɛn ho tap ɛdɛmu fiwa tap send in this street
the tap de no ana ɛkɔ
Taptap and one na eyi.
Piao.